Enti saa semwe mu no na oswafo a ohwe apomuden so kobnaminta kando dia desire to adwa ose woni die mu a obi bia ya post ni bia no wonhwe so obeko
Oswafo ne hwe apomuden sem so wo mai mu kobnaminta kando ene dia desire to medical officers ya posti wono mfofo krade akọ emia ya hodo se adaroma wono nhwa na bia de wono mo ato no wonko no nkoboma apomuden pamanfo nso entumi enye biwe wo kiremu dia wo dokota ne ne de wokoto mantem fofra no enye nkramantem ha eno nyese ye twa so ne mum no ba bebo ama manfo wono so wo mantem ahodo mu no etumi enya apomuden ye epa.
We will give them additional 1 week to appeal to them to report to their various facilities where they have been posted. After which we will do what we call validation. Unfortunately, there's no way we are going to change anything here. Unfortunately. And so we will give them 1 more week to report to their various health facilities.
And which in also for the same way since to ja.
And my doors are open. If there are any discussions or challenges, I'm willing and ready to meet them to try to resolve. But unfortunately, as we see on our records, there's no way we can change them. We have posted or allocated 21 medical doctors. As of Friday, 8 people have reported. Ashanti 33, 25 people have reported. Bono 29, 11 people have reported. Bono East 27, 9 people have reported. Central 34, 20 has reported. Eastern 34, 23 has reported. Greater Accra 20, 16 has reported. Northern Region 32, 7 has reported. Northeast 19, 0. OT 21, 1. Savannah 19, 7 has reported. Upper East 35, 0.